one more session of YouTube Live. So I hope everybody starts asking questions from the start only so that don't have to hurry or I don't miss out questions, because I think on Thursday Instagram Live I missed out few questions. I don't know exactly which questions I missed out. So if you ask the questions from the start only, it will be easy for me to discuss. Now today I just had one interesting case which I treated and cured also. Now this case, whenever you are taking a case or whenever you are taking a history, make sure, please remember that, make sure it is not important that how many rubrics you know, it is not important how many mathematical symptoms you know, nor it is important that how many what you call books you have studied. It is very important to understand that whatever symptoms you are taking for prescription, remember, whatever symptoms you are taking for prescription, that symptom should be an identifying feature of the patient's personality, and that symptom should be there in the patient as a characteristic symptom. Otherwise, in a normal case taking, you have the whole case with you, and you have tens and fifteens of rubrics, and then if you repetize that case in 15 rubrics, it would be difficult for you to identify which remedy comes to your repertory chart. It is very important to understand that you basically understand the disease, the miasm which the patient is suffering from, and repertorize the miasmatic schedule of the remedy. That is very important. Otherwise, if you repertorize with lot many of rubrics, only that rubric will polygraph will come to the repertory chart. And second, sometimes there are different approaches of repertory. Sometimes there are different approaches of repertory, and as the patient enters your chamber, starts speaking, you can identify so many rubrics. We have implied rubrics where you can convert that rubric into something else also. Sometimes it works, sometimes it doesn't work. It becomes very difficult to understand whether to take this rubric or whether to take that rubric. Okay, so I'll discuss a case. There was a case when the whole case was done. I think this case have been put on Instagram. I don't know whether they have put that or not. Welcome, Dr. Subhash, Dr. Vishaka. This was a child suffering from gastritis, already suffered from gastric ulcer, and again the symptoms of gastritis started coming. The whole case was taken and we found some remedies, but it did not work. The mother told that the child, sometimes it is very difficult for the child says, sir, I don't like this type of clothes, I like this type of clothes, I like that type of clothes. I don't like, which is very plain or dull or insipid. These type of symptoms the child was telling. I'll get to the remedy also, then you can also think of the remedy. I'll take on question first. I am a new practitioner. I want to set up a homeopathic clinic related to gastric problems only. Will that be right? A very interesting question, and I would like to answer it in detail. What is homeopathy first of all, and what has our master told us? If a cancer patient walks in my clinic, and a gastric ulcer patient walks in my clinic, and a patient of cough cold coriasis walks in my clinic, what will be the approach? We'll basically take the whole case, we'll repertorize, and then prescribe the remedy. So the disease will help us to identify which miasm the patient is suffering from. For example, I get a lot of cases of cardiology, and I treat a lot of cases of coronary artery blocks where a bypass is required, and with our medicines we can avert a bypass surgery and we can clear the blocks also. But as Dr. Hahnemann has said, that we treat the patient suffering from disease and not the disease itself. So it is whatever the disease comes in front of you, you have to take basically a very good case. As Dr. Kent has said, that a perfect case taking is half the work done, and then repertorize depending on the miasm of the patient disease. So whether it is a gastric complaint or it is a heart complaint or nephrology complaints, my suggestion to you would be case taking is important, repertorization is important, miasm is important, then whether it is any type of clinic. Just because sometimes some doctors want to become very famous for that part of that life. For example, for example, in cardiology, I tell you, I'm addressing a public, and I'm telling you detail about cardiology, what is ECG, what is echo, and what is this and what is that. The people are very happy. Why? Not because they have understood, but because they have not understood, and they find the doctor is so brilliant. Whatever what knowledge he has, what he has done, what he has taught. But my dear friend, it is important that you have to understand how many cases are you going to get, and how many cases are you going to cure in that complaints. So my suggestion would be, start a basic clinic, and if you feel that in your OPD lots of gastric complaint patients are coming, you can give some dates. For example, Monday, Tuesday, Wednesday, I'll only see gastric patients. But first start with the basic clinic, understand the concept of homeopathy, and then you can decide what you want to do. But homeopathy is a very vast science. You cannot club that I'm only practicing gastric and like that. Because those doctors who are claiming of practicing a particular part, I also, if I'm practicing more of cardiac cases, I see cases of piles also, I see cases of headache also, I see cases of hair fall also. Okay, so it depends on you. But for us, if you understand homeopathy, Hahnemann sir has already told us, basically take a good case and that's it. So the rubric, the symptom which I was telling in that case, a case of gastritis, a case of gastric ulcer healed, and then, yeah, hello Dr. Babel, Dr. Zeenat. Hello sir, can you please explain the drug picture of Aurum, mental and physical? Yeah, I will explain, but I just want to tell you what remedy I gave to that person. Now that child basically always he wanted something very attractive part, bhadkila part, nothing like plain insipid, nothing he did not like. I took a very interesting rubric, unattractive things see. Unattractive things sees. The only remedy in that rubric is China, and of course, yeah, China is there basically for stomach complaints. With few doses of China in LM potency, in 2 or 3 months, I was able to treat and cure his complaints. Now, for taking that rubric, you have to know first what is the meaning of unattractive. The other side is which is not attractive. Simple as that. It could be unappealing. It could be disgusting. It could be plain. It could be nauseating. So it could be unaesthetic also. So that unattractive has lot of meaning. So if you are able to understand that rubric in detail, I know you must have never taken that rubric, unattractive things see and give China. You must have think China, lycopodium, carboage, gastric, abdomen, there is bloating in the upper part, in the middle part, lower part, which is very difficult. So this rubric, unattractive things sees, I gave China, LM, absolutely cured. Did you understand the rubric first? That is very, very important. Then we can go to Aurum metallicum also. Did you understand that rubric, Aurum metallicum? China. Unattractive things sees, and the remedy, it worked. So I hope this is taken care of, everyone. Just 1 or 2 symptoms of China which I just wanted to share of China, but I think we have one. Did you understand China? Unattractive things sees, the rubric China. Understanding of rubric is very, very important, my dear friend. And then important is that rubric should work. That should work. That is important. Otherwise, I'll be a beautiful tutor for making you understand the meaning of rubrics. Beautiful tutor, you'll be very happy that, okay sir, you have taught us so beautiful rubric. But if you are not able to apply, then there is a problem. Sometimes the meaning of some rubrics are same. Just because I have told, I have got the result, you will take that rubric. Are you with me? Now let us see Aurum metallicum. Now Aurum metallicum, I always when I hear Aurum metallicum, I basically go to past where I treated a case in Dubai, a doctor in his own hospital. I think I have showed this case to Dr. Barbal. where we prescribed Aurum, and within 24 hours the patient came out from coma and the patient started walking. One symptom which I always remember of Aurum metallicum, what Dr. Kent has said, those students basically who are there online have heard this symptom from me every time whenever they say Aurum metallicum. Aurum metallicum basically is one line of Kent which I remember, that silently prepares for suicide. Silently prepares for suicide. Now, how do you explain this? There will be patient who is suffering from XYZ disease, but now he says that, okay, I cannot speak because I am I am a learned person, people respect me. So how will I react? He gradually, what happens? He starts eating less. He starts going less to social circle. He starts talking less. Gradually, everything slows down, and he lands up in bed. This is the meaning of silently prepares for suicide. Are you with me? Did you understand this symptom? Hello, Neil. Hello, Dr. Zeenath. Did you understand this symptom? Silently prepares for suicide. Now, this symptom has to be interpreted. No patient is going to tell you that I'll stop eating, I'll eat less, and XYZ. It is that's why homeopathy is all about interpretation. Homeopathy is all about interpretation. How well you interpret that symptom will guide you to the rubric. For example, I have discussed this case in my Insta live. I have posted this case also. There was a case of migraine which I was treating, was better, but was not able to cure that complaint. I had repetized, but it was not getting cured. I asked the patient, what happens when you have migraine? Oh, and he started telling, sir, whenever this migraine, no, I feel, my God, now what will happen? I have done nothing in life. What I have done, I could have done so much. Because of this pain, I can't go to the gym, I cannot study, I cannot give lecture. I don't know what will happen to me. Pain causes depression. Pain causes depression. This is a line written in sarsaparilla. So I prescribed the patient sarsaparilla, adding one symptom more. In case of migraine, my dear friend, single dose, and the patient has not got the migraine attack for the past 3 to 4 months. Sarsaparilla. This is the importance of understanding and interpretation. You could take that rubric, you could take that symptom in a different way also. Feels angry because of migraine, feels irritable because of migraine, feels sad because of migraine, feels loathing of life because of migraine. There are so many symptoms you can take for that symptom only, and I can explain you beautifully all the 4 rubrics in a lecture, and you'll be happy clapping to me. But if you have seen that case in my OPD, if you have seen that case actually getting cured, that will give you more confidence rather than clapping for a beautiful seminar or a webinar or a lecture that is very easy to give. Are you with me? So interpretation in homeopathy is the whole Aurum metallicum. I will give you that symptom, silently prepares for suicide. Did you understand what I want to tell you? That is important. So the transparency of interpretation can only be told if somebody is working with me, students are working with me, they have seen the result. You can ask my student, that is the doctor. Otherwise, in seminars and webinars, we present the best case. I don't know whether the remedy is given or not. But if you ask the doctor who is working inside the chamber, then your confidence will improve more, my dear friends. So Aurum metallicum, this is the symptom which basically I take for prescription. Kent's Metromedica. This is a symptom not given in the repertory. In repertory, there is one rubric which everybody should remember with the same thing. Anguish leading to self-destruction. Remember this, anguish increasing to self-destruction. The meaning in Kent is same. Silently prepares for suicide, self-destruction. The only remedy is Aurum metallicum. Did you understand, my dear friends? Very good. There is one question, so I'm very happy. Sir, which rubric to take when a patient only believes her sister or a friend, but not a family members, even though every time her family member actually resolves her issue? That's what I want to tell you today. Every time, everything is not prescribing symptom. Are you with me? Every time, everything is a not prescribing symptom, my dear friends. This is quite normal. Sometimes your elder sister, basically behaves like your mother only. You are very, as a brother also. I have an elder sister. Some things which I cannot tell to my mother or anybody, I tell to my sister. That's the quality of a sister. So every time it is not a symptom to prescribe. Understand that. Are you with me? A very interesting question. For example, I'll just give one example also. You have love for your family. Now, whether this is a disease or a normal thing, you love your family very well. So, whether it is disease or normal thing, it is normal. So, will you prescribe on that love for family? No. I'll just complete this thought, doctor, and then I'll go to Elaps. Now, I'll tell you one thing. I'll tell you important one thing. You have a rubric: quarrelsome, scolding, outrageous in family. And the remedy we have Kalikarp. In fact, now we had Kalikarp few years back, but now I think in Rapid there are few additions. They have put Kalikarp also with Kalimur and Kalifos also. Okay, understood that? What is that? Outrageous in family matters. Now there are other rubrics also which are very, very close to that, but the remedy is different. Recognizes does not, or you can say recognizes does not his relatives, ignores his relatives, sadness for his family, unhearted feeling for a family, so close, but the remedies are different. Fear what happens to the family member, estranged to the family members and relatives, the remedies are different. But because we have only taught that outrageous in company, even to family members, the remedy is Kalikarp, we only first think of Kalikarp. No, sometimes the doctors come to me and say, sir, this is a very family oriented man. He loves his family so much. So what should you prescribe? Or I say, this is normal. If you love your family, it's normal. In fact, prescribe if you don't love your family. That is the problem. So everything is not prescribing. I can tell a beautiful remedy, coffea cruda, coffea tosta, love for family. And this is normal, my dear friend. But because I have told you, because I have shown a cure and I have showed coffea, you will write in your books and then you ask you love your family and give coffea. It is not that. Some things are quite normal. Are you with me? Are you with me? So I hope you understood those. I'll just take one question, okay? Dr. Neil, I hope you understood that part. What to prescribe and when to prescribe. No, don't prescribe everything. Whether love for family is normal or abnormal, anybody? Whether love for family is normal or abnormal. I'll just tell you one thing. Normal. In fact, loving not your family then becomes abnormal. Then you can prescribe. Okay? So please, whenever you are joining people or joining doctors and all, make sure that you understand the rubric in a very, very detailed way and make sure that you are able to interpret the symptom of the patient. Normal, yes. This is a normal question. Sometimes I had a case. I had a very interesting. Yeah, it is normal. Very nice. I had a friend of mine who said, sir, he said, Abdequaem, a patient came to me in my OPD. He was suffering from expanded disease, and he came to me in my OPD and told, sir, your AC is not working properly. It is not. No, it's chilling outside. And I said, my God, so ego the patient has. I gave platina. I said, after 30 years of practice, a patient comes to my OPD. He does not have that guts to tell me that the AC is not working. whether he has come to sit in the AC or whether he has come to treat the disease. So for me, that is not platina, because the patient will never tell in front of me that, sir, your AC is not good, please repair your AC. Can a patient tell in front of me? Or any doctor who is having a good name, good practice, 30 years experience? This is a very petty thing. So for her, that was platina. For me, platinum will never come and tell you. So for everything, when you prescribe, make sure and differentiate from normal and abnormal. Are you with me? When you don't love your family, doctor, then you must have a cause why. For example, your father is very dominant, your parents are very abusive, the parents have not given you a choice to study, the parents have not taken care of you, the parents have never taken your side even if you were right, the parents were always scolding for you to get good marks. So there are a lot of other things why he doesn't love you. That's important. Very nice question. So I'll just take one question. Elaps. Now Elaps, my dear friends, Elaps basically is a snake. So of course all the qualities of snakes, which I'm not going to discuss. There was a very interesting case. That came to me. Okay, I'll not discuss the case. I'll discuss first some symptoms of Elaps. Elaps patient. I think I've told you a case of piles. Elaps patient will come and tell you, sir, whenever I read something, I understand what is going to happen, but I cannot reproduce. Now, understand what I'm telling you, sir. I understand, I read everything, but I cannot speak. I'm very bad at that. Elaps. Understands speech, but cannot speak. Please think. Yeah, father dominant. Yes, you can use that. Understands speech, but cannot speak. Are you with me? This is a very, very important. Elaps patient will always tell you he likes buttermilk. Okay. One symptom more also that you must look. Understand. Elaps. I had a very interesting case. Where the child was there. He was, I think, 5 or 6 years of age. I don't remember the age. Asthmatic patient, recurrent asthma attacks, was on inhaler, on steroids. I started medicine and I told him not to stop the steroids immediately. And the mother told me, sir, one thing also, maybe he has worms. I said, why? Whenever he's sleeping, he's biting his finger like this. In sleeping only. In sleeping, he's biting finger. So I thought it is not because of worms. So I was just looking at the Matra Medica and I got the remedy Elaps. Biting fingers in sleep. Only one remedy, Elaps. I said, okay, give Elaps. I gave Elaps 30 and the patient came to me after a week and said, sir, there is no problem of asthma, no attack, only he is suffering from cough and sneezing. Immediately after a week, I stopped all the steroids. And the patient is coming to me for the past, I think, 2-3 years for different type of complaints and all. No asthma, nothing, with few doses of Elaps. With only one symptom, biting fingers in sleep. Biting his own fingers in sleep, that is also very, very important. Are you with me? I'm just telling you cases. Matra Medica, you can go home and read Elaps. There are thousands of symptoms. But whatever I have understood in my practice and seen, that's what I'm discussing. Okay. I'm a clinician. I don't know what is, people think, but the symptoms which I have seen. So now we move forward. Now there are some. What is a good remedy? Now you can see again, Doctor. Every father, every mother, or every family. I am also father. I would like my child to get good marks. But whether my saying or my vocabulary or my presence is basically a dominating part, the child is feeling the dominance, that I have to understand. So if the child is feeling the dominance, then it becomes the prescribing symptom. Okay. So for elements from dominance, you can think the remedies like carcinosin is there, lycopodium is there, CPI is there, follicular means there, but actually the dominance has to be felt by the patient. That is what I am telling you. No, are you with me? Now I can present a beautiful case, sir. My father says, sir, my once or twice I tell, but it is not. The child has to feel that. You have to feel the dominance, then it becomes a rubric. Okay. Sir, what should be the potency and dosage of QLEX for itching? My dear friends, don't worry about the potency and don't. Basically, if I get a case of QLEX, I would basically start with a 30 potency. Okay. Yeah. Some questions have been scrolled up. So, did you understand? So, that is case taking. That is what I teach to my fellow doctors who are working with me. Whatever symptom the patient has told you, it is important the gravity what the patient feels. With which symptom the patient's constitution has been affected. That is the prescribing symptom. If you ask me after 30 years of practice, sir, what is I have gone through the stage of mortification, humiliation, stress and strain and cares about my parents, my family members, my daughter, my son, my brothers, my sisters. I have gone through that part. Everybody goes through that part. But which part of that has affected my constitution and had made me disease is the prescribing symptom. You can't always take elements from cares and worries. Otherwise, every case of 60-65, you will have the first rubric elements from cares and worries. Don't take that because that is normal. But that cares and worries has affected the patient's constitution, then take the rubric. Stramonium in child. My dear friend, first of all, understand Stramonium. Okay. Now, whenever you are prescribing Stramonium, there are few symptoms very, very important that should be taken care of. First, we can see Stramonium, the basic symptom, and then Stramonium, the implied symptom. So, the first of all, Stramonium, if you want to see a child or basic symptom, fear of dark. Now, fear of dark could be basic fear of dark, or fear of dark could be he wants everything transparent by you tell me and I'll tell you everything transparent. So please, basically, I don't know anything which is hidden. That's also Stramonium. Desires light and company. Matlab, tell me everything, plainly. I don't mind if you tell me on face, but please don't hide something. Desires company means you always want somebody with him so that he is very happy. Now, these are the basic symptoms. A child, what would say? Mummy, please, somebody he wants or she wants that should be there, so she is happy. That is desires. So much so, in Stramonium, I had a case where the patient had fever, he had taken medicine, not getting better, so he was in a delirious state. So the patient came to me. When I went to that child in delirium, the child was calling the parents. Calling the parents who are present, trying to console. Again, desires company, and the remedy was Stramonium. One more thing in Stramonium delirium is chattering. This is Stramonium, chattering. Are you with me? I am telling you an example of a case, then we'll go also in future also. Other symptoms also. One more symptom in Stramonium. One more symptom in Stramonium that I have seen in many of patients. And what is that? Fear. Fear of cemeteries. CEMETRIES. Very, very important. Very, very important. And again, if you go ahead, the gestures of Stramonium are important because it is a remedy which causes that toxicity in the brain. Gestures are important. And what you for gestures? Gestures extravagant. Gestures extravagant. Next time you understand this rubric and you can tell me what is the meaning of this gestures extravagant. Now, gestures, if the child wants to go to the bathroom, the child will say, These are the just indicates his desires. Whatever the child wants, he will indicate what he wants. So whatever he wants, he'll basically indicate by gestures. This is a Stramonium baby. Very, very important. Okay. So I hope you understood today. A lot of questions unanswered. It's already half an hour up, and I hope you enjoyed as much as I enjoy Simula with you. Until next Thursday for Instagram Live. Bye. I'll again ask me the question. I'll tell you the answers for that. Thank you so much and bye.